Hi, I'm Rob Klein with the G-Site team, and joining me today is Drew Diskin, the Director of Marketing Technology for Virtua Health. Drew, thank you so much for being with me today.
Thank you for the opportunity.
Great. Just a few questions for you about G-Site. What's one thing that G-Site maybe has told you that you guys didn't know before?
I think the fact that we could really tap into what people were trying to do. It's very easy to look at the questions that we asked on the website. For the first time, we were really able to see what people were trying to do. Mm-hmm. And that really led into the next level of discussions and then a strategy to support that.
Give me an example of how G-Site information has helped guide some of your design or redesign efforts.
Sure. So the two areas in particular. So one, with measuring intent, we understood that people come to our website for a variety of reasons, whether it be finding a doctor, finding a location, learning about treatment within a specific area. Essentially, though, making appointments is still really the core of our business, and it's with that enables. The other area was in chat, and we realized how important it is to engage with people at a time of this heightened state of emotion. They need to find someone to help them or a loved one. It's something that we realized from the feedback from G-Site. We saw that we could actually improve our internal operations at our access center. And now we have a digital first team that responds to chat. And so it's not a new thing, it is the thing. And this team is focused completely on making sure people in chat are having that real-time feedback that they're expecting. We realized that we could capitalize on those who are needing that interaction quickly. We were able, for those wanting to make that appointment request through chat, we're now converting 89% of those.
Do you know what it was before, by any chance?
We were losing 50% of all people coming to chat.
Wow.
So the numbers are exponentially greater, and the feedback has been wonderful. We're getting people to where they need to be. One of the things that we're doing with data is we're using it as a real-time beacon for change. So instead of looking backwards, we're looking forward. And we see data as a way of helping us inform the decisions we make. And so when we do look back at things, we can see how we're moving forward. So the analysis is real, and the G-Site platform gives us that real-time look.
What would you say is one business metric that you've noticed the most improvement in?
Well, definitely chat, for certain. I think the areas now where we're finding where people are trying to get better information on or engagement with, whether it's our My Virtua, which is our electronic medical record access, people are trying to do that better. We have teams in the organization focusing on that specific area of the business, that digital front door. It's for retention, it's obviously for customer service, absolutely about health care. But in the moment that people come to that website and they're trying to find that or sign up for that, it's telling us we can do better. And again, with that humility to keep improving and keep failing fast, we're cycling more resources through making things better, and we can look at the feedback we get as well as the numbers to tell us the throughput.
And just lastly, if someone asked you, why do you like G-Site? What's maybe one thing that you would say to them?
It's real. It's real as in it's authentic, it's transparent. All of us have the ability to get data on our own. But when you spend hours in Google Analytics, you're always trying to figure out, is this the right way to look at this view? Am I collecting data the right way? With G-Site, it is truly our information in front of us. It's telling us everything we need to know. And I would also add, with the team at G-Site, having someone to talk with, which also, a real person with all that technology is very helpful because it lets us get an understanding where the benchmark is, where we could do better. And in that moment, it is very real. We know if we're hitting it, if we're not, if we have room to grow. We can set our expectations realistically.
Drew, thank you so much for your time today.
Thank you.
And thank you for viewing And if you'd like more information on G-Site, please contact Melinda McDonald. Her information is at the bottom of the screen. And again, thank you so much.